y'all, it's April Green, registered nurse here again, and I just wanted to remind you to go back and watch the first general surgery video if you haven't yet. That just gives you all the information that you'll need to know for any surgery here. But today we're going to be going over a mastopexy or a breast lift in this video. So the items that you'll need at home are your prescribed medications that you'll get at your pre-op. So you'll have an antibiotic, a pain medication, a nausea medication, and possibly a Flexeril, which is for muscle spasms. So you'll also have this Cinex medication that helps with rapid recovery. It's a homeopathic arnica. It helps with bruising and swelling after surgery. To take this, you'll take a pre-op dose, which is going to be the night before surgery with dinner. You'll just take one pill, and then the next dose will be a post-op dose, which is after surgery, and then one that night at bedtime, and then it's taken 3 times a day. The only ones that you'll need to completely finish out is the Cinex medication and your antibiotic. You'll also need a mammogram if you are older than 35 or older. You'll need some lab work done that you'll get for general anesthesia, a CPC, a CMP, a PT with INR, all those things we need to look at before we put you to sleep. Then you'll also need some hydrogen peroxide and distilled water to clean your incision sites with. And we'll let you know on your post-op appointment whenever you need to start cleaning your incision sites. So we don't want you wearing any lotion the morning of surgery because Dr. Brayman is going to mark your breast, and so we don't want that marks coming off. We do want you to wear a button-up or zip-up top that's kind of loose that we can put you in after surgery. You will be in a post-operative bra after surgery for about 4 weeks normally. We do want you to bring a pain pill and a nausea medication with you the day of surgery, especially if you live about 30 minutes away or more, just so you can have that on the car ride home if you need it. So now we're going to talk about after your surgery. Like I said, you'll restart your antibiotic medication and the Cinex medication whenever you get home with a light meal to avoid any nausea. We do want you to sleep kind of semi-sitting for about 2 days after surgery. So that can mean propped up on a bunch of pillows in bed, or even sleeping in a recliner is acceptable. You will actually come back and see us the next day after surgery so we can check everything out. So know that if you do live far away, you might need to get a hotel so you can come and see us the next day. And after that visit, you are allowed to shower. So the way you're gonna shower is you're gonna kind of let the water trickle down your breast. You're not gonna like stand right directly into the shower, especially if you have like hard water pressure. But you can kind of clean with soap and water up here and then just kind of let it trickle down. You will have a white tape on your breast. It's kind of in the shape of a circle, and then you can kind of see your nipple poking through, and then it'll kind of tee down normally. And that white tape is going to stay on until we take it off, which is normally around a week or 2 after your surgery. So if that white tape tries to ever come off a little bit, you can get your blow dryer on the cool setting and kind of just pat it back down, dry it, and it should be able to stick back down again. And if it doesn't, then you can always give us a call. Don't freak out if it comes off. It's not a huge deal, but we do need to get you some more tape if it does. Just make sure you never use any heat on your blow dryer because you might be a little bit numb in that area, and we don't want you to burn yourself. Like I said, you'll have a surgical bra that you'll be in after surgery. You are going to wear that at all times unless instructed otherwise. About a month you'll wear it. After your incisions are all healed up, you can use ScarGuard, vitamin E. We have a great scar gel by Skin Medica up at the front that you can use. But you do want to avoid any strenuous activity for 4 weeks after surgery. So this includes lifting, pushing, pulling, straining. Try not to lift more than 10 pounds for that first week after surgery, and no more than 20 pounds for that next 3 weeks. So basically discontinue any regular exercise program, weightlifting, running, nothing like that. As far as complications go, if you should develop any significant pain in one breast with significant swelling, like around your collarbone, or deep purple bruising on your breast, you need to call us immediately for any of that. Depending on if you get an implant along with your breast lift or not, sometimes the bottom of your breast might look irregular and flat on the bottom for a little bit until they take their normal contour, which can be quite a while until that occurs. You do want to avoid any sun exposure, including tanning beds, directly to your incision sites for about 12 months. They will hyperpigment in the sun, so just know that. Be sure to continue your monthly self-breast examinations. And whenever you get your next mammogram, let them know that you have had breast surgery. No underwire bras during your post-op recovery period. Like I said, just that bra that we give you after surgery. You can resume driving in about 72 hours after surgery, or after you take your last pain pill, you're going to wait about 24 hours before you drive again. So don't drive and take your pain medication. Just because you get your breast lift doesn't mean you need to run around going habitually braless or anything. Your skin can still sag and droop if you do that. So make sure you're wearing a nice bra every day, and even a bra, like a sleeping bra, is great to have. So just know that it can take about 6 months to a year for your breasts to settle into their final appearance. And that's really it, guys. A lot of our breast lifts do include implants. You don't really need to know anything else other than not to breastfeed for 6 months after with those implants, but all of the care that you're going to do is a little bit different with the breast lift than it is with just an AUG. So you're going to listen to all of those instructions that we give you for just the mastopexy, the breast lift. So we don't need to go over any of those other ones. I don't think it mentioned for about 4 to 6 weeks after, you aren't going to take any tub baths or swim in any lakes or pools or oceans, just strictly showers for 4 to 6 weeks after. Another thing I think I forgot to mention is that we will send all of the tissue that we get from your breast to pathology to make sure that there's no cancer in that tissue or anything like that. But yeah, that is really it. We can't wait to see you at your pre-op. If you have any questions, just gather those and we'll be glad to answer them for you. Thanks, guys.